Welcome to Glucose. Hey guys, you may have heard about monkeypox in the news recently, but what is it? What are the symptoms and how dangerous is the monkeypox virus? We will talk about what you need to know about the pathogen, formerly called monkeypox. What is monkeypox? Monkeypox, previously known as monkeypox, is a viral illness caused by the monkeypox virus, a species of the genus Orthopoxvirus. There are two distinct clades of the virus, clade 1 with subclades IA and IB, and clade FAQ with subclades 2A and IB. In 2022-2023, a global outbreak of monkeypox was caused by the clade TB strain. Concerning etiology of monkeypox, outbreaks in Western and Central Africa have been linked to the following factors. 1. Exposure to rats, rabbits, squirrels, monkeys, porcupines, and gazelles. 2. Inhabitants of remote tropical rainforests may become infected from direct contact while capturing, slaughtering, and/or preparing these animals for food. 3. Ingestion has also been linked to infection. Consumption of such so-called bushmeat is particularly hazardous because the flesh is often undercooked. Because of the diversity of animals eaten by local inhabitants, conclusions about the relative risk of meat sources are not known. With certainty, monkeypox virus has several modes of transmission, such as contact with ill animals or animal reservoirs from Western Africa, e.g., prairie dogs, rabbits, rats, mice, squirrels, dormice, monkeys, porcupines, gazelles. Additionally, preparing or ingesting infected animals can transmit monkeypox infection. Finally, direct cutaneous, skin-to-skin, or respiratory contact with an animal or a person who is infected can transmit the infection. As a clinical picture, monkeypox can cause a syndrome clinically similar to smallpox, but overall is less infectious and less deadly. And the incubation period averages 12 days, ranging from 4 to 20 days. In the prodromal or pre-eruptive stage, lasts from 1 to 4 days prior to the onset of rash, fever is commonly the first symptom, usually from 38.5 to 40.5 degree. The febrile illness is often accompanied by chills, drenching sweats, severe headache, backache, myalgia, malaise, anorexia, prostration, pharyngitis, shortness of breath, and cough, with or without sputum. Lymphadenopathy appears within 2-3 days after the fever. In the 2003 outbreak, 47% of patients had nodes measuring several centimeters in diameter in the cervical and submental areas. In the exanthem or eruptive stage, most persons develop a rash within 1 to 10 days after the onset of fever. The rash often starts on the face and then spreads to the rest of the body. It persists for 2 to 4 weeks until all lesions have shed the crusts. However, in the current outbreak, painless anogenital lesions, which often without a prodrome, are being observed in persons who have had close contact with an infected person or persons, including men who have sex with men. Encephalitis with immunoglobulin M, IgM, found in the cerebrospinal fluid has been reported. And for differentiating monkeypox from smallpox and chickenpox, the most reliable clinical signs enlarged lymph nodes, especially the submental, submandibular, cervical, and inguinal nodes. About complications of monkeypox, they include pitted scars, deforming scars, secondary bacterial infection, bronchopneumonia, respiratory distress, keratitis, corneal ulceration, blindness, septicemia, and encephalitis. Concerning diagnosis of monkeypox, identifying monkeypox can be difficult because other infections and conditions can look similar, such as chickenpox, measles, bacterial skin infections, scabies, herpes, syphilis, other sexually transmitted infections, and medication-associated allergies. Someone with monkeypox cases may also have another sexually transmitted infection at the same time, such as syphilis or herpes. Alternatively, a child with suspected monkeypox may also have chickenpox. For diagnosis, the preferred laboratory test for monkeypox is detection of viral DNA by polymerase chain reaction, PCR. The best diagnostic specimens are taken directly from the rash or skin, fluid, or crust, and collected by vigorous swabbing. In the absence of skin lesions, testing can be done using swabs, or the throat, or anus. HIV testing should be offered to adults with monkeypox and children as appropriate. Diagnostic tests for other conditions should be considered where feasible. For example, varicella zoster virus, VZV, syphilis, and herpes. Regarding treatment, the disease is usually self-limited. Resolution occurs in 2-4 weeks. In the African cases, the mortality rate was 1 to 10%, and death was related to the patient's health status and other comorbidities. Most patients died of secondary infections. No fatalities were reported in the 2003 U.S. outbreak. Patients often feel poorly during the febrile stage of the illness. Therefore, bed rest along with supportive care may be necessary. Hospitalization may be necessary in more severe cases. A negative pressure room is preferable. For further prevention of monkeypox, in September 2019, the U.S. Food and Drug Administration, FDA, approved and live attenuated non-replicating smallpox and monkeypox vaccine, JYNNEOS, for immunization of adults at high risk for smallpox or monkeypox infection. There are 2 doses of vaccine and both recommended doses of JYNNEOS vaccine at least 28 days apart. For further than prevention of monkeypox, after talking about monkeypox, we need to answer about the important question which says, is the monkeypox a new pandemic? There is no clear answer, but monkeypox is nothing new, and the virus is endemic in several countries. But when cases started appearing beyond the expected places and among people who didn't travel to those endemic regions, researchers paid attention. That's all about monkeypox. Thank you for listening, guys, and see you in the next video.